I want to start a couple of things. First of all, the information we're going to provide today is based on the latest information that we have here through our public health agencies, and we're constantly assessing what we're experiencing here in New York City. This is, again, another reason to appreciate the work of our disease detectives at the Department of Health, who are not only working on specific cases and helping to address the specific individuals, but they're also gathering a huge amount of new information. This is basically research that's happening right here in New York City, giving us direct knowledge of how this disease is acting so that we can make the best strategic judgments. There is a lot of information out there in the global health community, national health community, but everyone understands there's still a lot that is not understood about this disease. Again, this is a disease that at this moment does not have a cure, does not have a vaccine. So the fact is that the ability to constantly gather new information and understand the way the disease acts in real-world conditions is crucial. We talked about this yesterday. There's a real difference between real-world conditions and a laboratory. So we are getting more and more information, and it is affecting our understanding and therefore our strategies. You'll hear those updates as we go along. Also want to emphasize this, of course, is an ever-changing situation. There are times we get guidance from the World Health Organization, from the CDC, State Health Department, obviously our own health officials. Sometimes there are areas where there is not clear guidance, or there's different guidance, different levels of government. We're constantly assessing, refining. So this is an ever-changing situation. We will update you constantly. You will see variations. We'll try and identify those variations and why they're happening, but you should expect it. You should expect changes in information, changes in approach as we go along. Therefore, the things we say in many cases are preliminary because the information about the disease is preliminary. We hope over time to get a much deeper understanding. But we can say some things with, a high level of certainty based on actual experience so far. And I'm going to repeat today and probably several other times in coming days what we understand about what is called transmissibility, which is literally the process through which the disease goes from one person to another. Because there's still a lot of misunderstanding out there and a lot of mythology out there. So I'm going to put it, again, in very plain graphic terms, because I think New Yorkers, we are blunt and straightforward people. People want to hear the truth about this stuff. And the way I try to explain it is sort of what it is versus what it's not. So what it's not is a disease like some that hang in the air, for a prolonged period of time, that you can come into a room hours later after someone has been there with the disease and you have a danger of contracting the disease. That is not what we're talking about here. This is a disease that requires a very direct level of contact. The question of surfaces has come up a lot. The best understanding of our public health officials is that this is a disease that does not live long on a surface. Certainly on most surfaces like metal, plastic, a desk, a kitchen counter, a subway pole, it's only a matter of minutes before the disease dies, the virus dies in the open air. If it got on a part of the human body that's not the mouth, the nose, the eyes, might live a little bit longer, but still a very limited period of time. And the only way it can become active and affect you is if it gets into the mouth, the nose, the eyes. If the disease got on your leg but nowhere else, you don't get infected. We talked yesterday about if somehow someone sneezed over some soup they were serving you and then you drank the soup, you're not going to get infected. Same thing with a glass of water. It has to be direct fluid from one person right into you, which means a cough, a sneeze right at you, that you receive directly into your mouth, your nose, your eyes, or potentially onto your hand and then immediately onto your mouth, nose, eyes. A lot of us, and I'm one of them, often touch our face. It's kind of a normal human reaction, normal human habit. You want to try to do that less nowadays, in addition to all the other precautions, the washing hands and the alcohol-based sanitizer. It's great to try and reduce that contact between your hand and your face. But if it doesn't get into those parts of your face, it doesn't get in. That's what we understand at this point. And when we talk about the close contact, we've seen this in cases. Again, we understand if someone sneezed right at you, they coughed right at you, they did not do this like they're supposed to. You're supposed to cover your mouth when you cough or sneeze into your elbow. Someone just sneezed or coughed right at you, yes, direct hit, that's a real problem. If you're deep in conversation with someone right up next to you and they're vehemently talking and some spit comes out and it gets right into you, that's a problem. It is not a problem if someone is 10 feet away and they sneeze. It's not going to reach all the way over to you. But if it's close to you, that's where the problem occurs, and that's what we want to be mindful of. So those are just basic points I want to say up front. The other thing I really want to emphasize, and I've been working with our health officials on this because there's been a lot of misunderstanding, and we really want to get right to people who's vulnerable and who's essentially not. Now, I'm going to say on this one, again, I'm the layman here. I've been talking to these public health officials now for days and days and days. I'm trying to composite the information, make it simple and clear for New Yorkers to use. I'll put an asterisk on and say there are always exceptional cases. So I'm not saying I'm giving you, a perfect rule that affects every single time, but this is the basic rule, overwhelmingly consistent rule based on what we have seen globally from this disease. So I want to start with who is most vulnerable. It's abundantly clear who is most vulnerable to contract coronavirus. It is people who have pre-existing serious conditions and are over the age of 50. And those pre-existing conditions, and our team has really been working to get this definition clear for everyone because we think it's helpful if it's very, very clear. So the pre-existing conditions in question are heart disease, lung disease, cancer, immune system vulnerability, and diabetes, thank you, and diabetes. Those 5, I'll do it again. Heart disease, lung disease, cancer, compromised immune system, and diabetes. Those 5 pre-existing conditions. And then one other thing we could call a factor. It's not a pre-existing condition, but it is a factor that we are concerned about and we've seen already. If you are a smoker or a vapor, that does make you more vulnerable. And we'll say it probably several times today and in the days to come. If you are a smoker or a vapor, this is a very good time to stop that habit, and we will help you. Our health department and our colleagues in the state have a lot they can offer people who want to quit smoking or want to quit vaping. If you can do that, if you want to do that, please do that now. It is a very good time to take that vulnerability off the table. Call 311 if you need help. So for folks who have one of those 5 pre-existing conditions, or God forbid more than one, even more. For folks who have that reality that they're a smoker or vapors, they're in particular danger. And if they're over 50, that is the category where we're seeing the biggest problems by far. That's where the real danger is. Those are the folks, God forbid anyone passes away, but overwhelmingly the folks in greatest danger, the folks we have the greatest concern about whether they will still be alive at the end of this is the folks who are in that category. Okay. The next category to think about is folks who have those pre-existing conditions but are under 50 years old. So the pre-existing condition is a deep concern at any age, but a much deeper concern if you're over 50 years old. The next category is a healthy person over 50. Now, a healthy person over 50 in most cases is going to do fine, but there is somewhat more vulnerability if you're over 50. And then the last category, thank God, is the biggest category of New Yorkers. Under 50 years old does not have one of those 5 pre-existing conditions or smoking and vaping. That's the single biggest category of people. And for those people, by and large, if you contract coronavirus, you're under 50, you don't have those pre-existing conditions, you will generally experience it the same way you do a common cold or flu, and it'll be unpleasant, but you'll be okay in the end. We see very consistently with children, again, this is not a perfect rule, but it has been a consistent reality. Children who do not have pre-existing conditions, their general experience, again, will be that of something like a common cold or flu. So I want to reassure parents on that point, but I also want to say to parents who do have children with those pre-existing conditions that we want you to be very vigilant. Make sure they do not come in contact with folks who have symptoms. And obviously, if any child who does have those symptoms develop, we want to be very careful to get them care right away. But I want to be clear about where there is some good news, and the good news is, for the vast majority of New Yorkers, they are in the less vulnerable categories. Okay. Let's go over numbers, but first, one other thing, there's going to be constant flow of information in lots of different forms for folks who want to get connected to information. You can text the word COVID, C-O-V-I-D, COVID, to 692-692, and you will get regular updates from the city. Let's go over numbers. As of yesterday, we had 12 positive cases since the beginning of this crisis. There's one new one, and I'm going to say up front, we are gathering information on this new case. We need a little more time to get all the facts 100% clear, so we'll have an update on the new case later on today. I can only tell you in New York City, in the Bronx, but I want to get all the facts straight before we give you more. So 12 as of yesterday, plus 1, 13 as of today. 7 new cases since Friday. Negative tests, we are now at 146 tests that have come back negative, and that is 60 new tests since yesterday. So we'll keep giving you those updates as long as we can. Now the numbers, I'll just finish it and say we also have 76 tests outstanding that we're waiting for results on that we'll know by the end of the day. I'll go over specific cases in a little bit. Our goal is to keep giving you the numbers and the case breakdowns as long as we can. There well could be a point where the number of cases gets so large that becomes impractical to be able to give you that level of detail. We'll keep giving you updates as much as possible. I think it's fair to say, you know, right now for a crisis that's been going on 6 weeks or more in this city, we're at 13 positive cases. I think we could well be at 100 cases or hundreds of cases over the next 2 or 3 weeks. We have to be prepared for that reality. So we're going to, today I'm going to give guidance and updates. But as we end up in a situation where there are more and more cases, again, we'll be able to give updates, but maybe not as fine-tuned in real time. It's also important to say that our public health apparatus is already planning on the assumption that we will be at hundreds of cases soon and is ready for that reality. We'll talk about that as well. Fundamental change has occurred in the last few days. This was overwhelmingly, until this week, a problem related to travel. And there still are travel cases coming in. The last few days, last 24, 48 hours, several of those new cases. We have one that's related to travel to Italy, one related to travel to Chile, one related to travel to Egypt. So it's not that the travel issue is entirely over. But what is coming up now, unfortunately, is the community spread reality. And that's where you're going to see much greater numerical growth. There are things that we can do to address community spread. So I think that the way to think about this is phase one was travel essentially, and there were very specific strategies we could use to address something that was being brought in by travel. We're going into phase two now, where the dominant reality is community spread, and we're going to have instructions on how to deal with that. You'll get guidance today, and the guidance will be constantly updated. But finishing on travel, because it is still pertinent, we had canceled school trips to 5 affected countries. We are now taking the next step, and we're banning school international trips across the board out of abundance of caution. Also, for our city workforce, there will be no non-essential international travel at this point. We're going to put some other actions into place. Again, this is a lot of different pieces. They won't flow in perfect order, but bear with me. A lot of concern has been raised about our small businesses, many of which are really hurting right now and are seeing fewer customers. I'm going to just tell people, we're going to give you guidance every single day. We'll update it. I am still going out to small businesses. I am saying to my fellow New Yorkers, unless you have particular vulnerabilities or you have symptoms, I believe you can go about your life, continue to patronize our small businesses, and I urge you to. But we have to provide some relief for the businesses that are hurting right now, so we have 2 forms of relief we're going to implement right away. For businesses under 100 employees, that can document a decrease in sales of up to 25%. They will be eligible for no-interest loans, and those loans will be up to the dollar figure of $75,000. So we will be able to get money in their hands to tide them over. The details of that initiative we'll put out. This is something we just got approved. We just finished the process on. We'll get you further details on it in the course of the day. For our smallest small businesses, under 5 employees, a lot of mom and pop stores, neighborhood-based stores, under 5 employees, we will offer grants of up to $6,000 to help them retain employees. That's a literal direct cash grant to very small stores at a point where they may have to lay someone off. We'll get some money in their hands as a grant to help them keep people employed. And any business under 5 employees that's suffering an immediate crisis because of what's going on can call 311 and they will get help getting that assistance. In the schools, again emphasizing children in general at low risk, but children with those pre-existing conditions we are very vigilant about, want parents to be vigilant as well. We're going to add 85 nurses in the course of the week to ensure that every school building will have a nurse on call, on duty during the school day, remembering that some buildings have 1 school in them and some buildings have multiple schools in them. Every building will have a nurse, and that will be implemented in the course of the week. Continuing with the guidance we want to provide people, and remembering again that real, clear, distinct difference, pre-existing conditions, especially above the age of 50. So the issue here is to think in terms of symptoms, and the particular concern would be if someone had fever plus either cough or shortness of breath. So we're going to keep providing more pinpoint information. If you have fever plus cough or shortness of breath, we are particularly concerned and then much more concerned if that's accompanied by those pre-existing conditions. And again, our health commissioner will go into more detail. Crucial point, if you're not in a high-risk category, again, that biggest the biggest category of people, low risk, biggest low-risk category, under 50, no pre-existing conditions, particularly for folks in that category. If you got symptoms, first thing to do is to alert your healthcare professional. If your symptoms are moderate, you can stay home. If they improve, that says everything. If they don't improve, we want to get you in, we want to get you tested. There's been a lot of questions about public events. This is going to be a question we're going to ask ourselves every single day and update you every single day. Based on the information we have today, we are not altering our stance on public events, but we are making clear, people, I think it's straightforward and obvious, but it bears being said in a straightforward fashion. If you are sick, you shouldn't be going to a public event. If you are sick, you shouldn't be going to work. If you're sick, you shouldn't be going on the subway. Now, if you are not sick, but you're in that particularly vulnerable category, over 50 pre-existing conditions, you should avoid unnecessary public activity. There's some things someone may have to do, but you should avoid unnecessary public activity. We'll go over the basics every single time. Commissioner will say it again. Wash your hands. Use alcohol-based hand sanitizer. Dan Nigro is going to be my test model. Come forward with your elbow. Let me see your elbow. You can do this. Okay, do it again, Dan. That's our new handshake until further notice. And just be very aware of symptoms. Don't ignore them. Don't explain them away. We have a couple of things we want people to make adjustments on, and for some people and some employers, this will be something they can do readily. For others, more challenging. But this is guidance, and it's pretty much common sense guidance at this point. For employers, if you can institute telecommuting or more telecommuting, you should. So if you have the kind of work where telecommuting is a possibility, or if you're using it now and think you can use it more, we'd like to see you do that. See how much of that you can do, the more the better. Employers who can stagger their work times, that would be very helpful. Right now, at the height of rush hour, obviously people, we've all experienced it. We've all been the sardines in the subway. We're in super close proximity. We'd like to open that up a little more, and one of the good ways to do it is to stagger work hours. So any employer who is in the possibility of staggering work hours, that's helpful. If people typically come in at 9 a.m. and they can come in instead of 10 a.m., that helps. Or if you have different people who can come in at different hours a little more, that helps. And then everybody, of course, following the basic rule, if you're sick, stay home. If you become sick at work, get out of the workplace. If it's mild, go home. If it's more serious, get to health care. Remember, we have a paid sick leave law in this city that grants people 5 days annually. And as you'll hear from Dr. Barbeau, typically the symptoms we're talking about here manifest and give us a clear sense of direction within 2 or 3 days. So the paid sick leave is there to give people the opportunity to be home in just these kinds of situations. If you are traveling by subway and the train that comes up is all packed, and you can possibly wait for the next train in the hopes it might be less packed, please do. Very common sense measure, something a lot of us do anyway. If you have the option of walking to work or taking a bike to work, please do. Buses can be very crowded, probably pound for pound a little less crowded than a lot of subways. If a bus is a less crowded option and you can use that, please do. In terms of the guidance to healthcare providers, obviously we're making very clear that we are now in this next phase, this phase 2, which is where community spread will be where the vast majority of cases are coming from, not travel. Specific guidance is being given to providers to the max extent possible to have healthcare professional meeting patients as they enter healthcare facilities, or just outside, I should say, the healthcare facility. The commissioner will clarify, to make sure that if they need a mask put on them, that happens, or they need to be handled in a particular fashion, that happens. In terms of the federal government, we've made multiple appeals, and I think, yes, here we go. This is the letter we've sent to the FDA. This is one of many communications we've sent to the federal government asking for help on testing. This relates to the issue of automated testing that would allow us to do not only hundreds but potentially thousands of tests in a single day and get same-day results. Can't do it without FDA approval. We've asked for days now. We are awaiting that approval. We need that approval. It's one of the best things the federal government could do to help us. Everyone knows this has been a really persistent problem. The federal government has been slow and elusive on all questions of testing, but this is one where they could finally get it right. That FDA approval would make all the difference in the world for us. Also, we're putting out, this kind of summarizes a lot of what I've said, we're putting out this simple flyer. You'll see it a lot. The basic rules that I've outlined here. We're going to be doing an advertising campaign to get the word out on this as well. Okay. I'm going to go through some numbers and some cases. The number of folks in mandatory isolation has gone up to 19. They get a daily call to check on them. They get unannounced visits in person twice a week. If they violate the standards of the quarantine, they will be fined, and they will find a police officer at their door on a regular basis, and that will either be NYPD or the Health Department police. Again, I'm saying that out of abundance of caution. I think overwhelmingly we are seeing people are honoring quarantine. They have, like everybody else, heard weeks and weeks of warnings about coronavirus. We don't find a lot of people taking quarantine lightly so far, thank God. The voluntary isolation number has gone down substantially, and that is related to the fact that we are getting fewer and fewer travel cases, and people have gone through the full 14 days. But of course, that number will continue to change. You'll see fewer and fewer travel cases. You will start to see more community spread related cases. But as of today, in voluntary isolation, 2,176. They are now getting a regular communication pattern. In the beginning, they're provided information, including a robocall and a text on how to approach the quarantine and what to do if they develop symptoms. They get repeated texts and constant requests to know if their condition has changed, what to do if it does, if they need immediate assistance. We're going to be continuing to deepen that communication. We'll have more to say on that. A couple of updates on some other issues that come up. On schools, in addition to our traditional public schools, we have made clear to charter schools, religious schools, private schools, that if they need any additional cleaning supplies, they will be delivered tomorrow. And we have requests. And we have requests from 132 Catholic schools, 59 Jewish schools, and 1 charter organization which means multiple schools. And those deliveries will be made tomorrow. In our traditional public schools, the mandate is abundantly clear and obvious. Every bathroom has to have soap and towels in abundance. Sinks have to be working, and school personnel will be held responsible for that being kept consistent. Officials of the DOE will be spot checking schools on a regular basis. We had one case that was particularly notable of price gouging. A hardware store known as Sheeman and Grant in Midtown. They have been fined. What they did was unacceptable. We're using them as an example. The inspectors have been on site. The case has been referred to the Attorney General as well. Any price gouging, we want it reported immediately to 311 so we can act on it. Just saying to all store owners, absolutely unacceptable. Come on. This is a crisis. Help your fellow New Yorker. This is not a time to try and profit. And we'll be giving plenty of messages to people in different elements of the business community about how to be responsible at this moment. As I said, we have 7 new cases since Friday, one of which you will get the update on later, which is the Bronx case. The information we're providing you is what we have, and it always keeps evolving, so it's preliminary, but we'll give you updates as we get more. The family on the Upper West Side, the father had tested positive, age 51. This is a family that has a nexus to that cluster in Westchester County. Of the family members, the mom of the family and one daughter, mom's 47, the daughter's 11, tested positive. None of them have pre-existing conditions to the best of our knowledge, the dad or the mom or the daughter. All have been symptomatic. All are doing well now. Isolated at home. 2 other daughters, ages 8 and 10, have tested negative. No other close contacts per the work of the disease detectives. We have, and again, we're trying to keep this in a little bit of numerical order. Those were cases 6 and 7 positive tests. Case 8, the Uber driver in Far Rockaway. 33-year-old man. He is an Uber driver. He is not a TLC Uber driver. He works in Long Island, so he's not under TLC jurisdiction. Had pneumonia related to coronavirus, now in stable condition at the hospital in Far Rockaway. Family has been contacted by the disease detectives. All family members in isolation, all family members asymptomatic. That is his wife, 3 children, mother-in-law, father-in-law, brother-in-law, sister-in-law. All asymptomatic, all in isolation at home. The hospital in Far Rockaway, St. John's Episcopal, had a situation there where 41 staff members, and this is again one of these abundance of caution situations, may have experienced exposure. They are all now in voluntary isolation, being monitored regularly, none symptomatic at this point. The hospital has been provided with support to have additional resources and personnel, and at this point reports normal operations. Cases 9 and 10, 2 women who went on a cruise to Egypt. So here's travel now coming back as a factor. 2 women from Brooklyn. They are 66 and 71 years old. No pre-existing conditions. Returned to New York City February 20, so that's now over 2 weeks ago. They were symptomatic. They did the right thing. They immediately isolated themselves at home. They are now asymptomatic and still at home. No close contacts who require follow-up. Those are cases again, 9 and 10. Case 11, 39-year-old man from Brooklyn who was in the affected area of Italy. Came back March 2nd. Symptoms manifested March 3rd. In serious condition, in a voluntary or private hospital in Manhattan, does have pre-existing conditions. Serious condition now, as I said, one close contact business associate tested negative and is in isolation. Case 12, 58-year-old male returned from Chile. Apparently contracted coronavirus during a lunch with a confirmed coronavirus patient in Chile. Lives in Manhattan. I need a reality check because I don't have this much fine-tuning. Hypertension, Dr. Barbeau, is in the group of pre-existing conditions or not? Okay, so does not have one of the pre-existing conditions. Was in a hospital in Manhattan, has been discharged, doing well, now at home. No close contacts to follow up. So that's the cases to date. We'll get you more on the Bronx case later. Just some other follow-up from ones we've reported earlier. The Westchester family, all doing well now. And then the employees at the law firm Lewis and Garbuz. 4 New York City resident co-workers, all negative, as we've said before. 4 non-New York City co-workers. We have 1 Westchester coworker negative, 1 New Jersey coworker positive, 2 remaining coworkers, 1 from Westchester, 1 from Nassau, both asymptomatic. And then another piece of news, because we had talked before about the healthcare worker from New Jersey who had seen patients in New York City, 32-year-old male. Specific information we want to give you now. He saw 11 patients while symptomatic, but he did wear a mask and gloves during that, which is important, and lessened the chance of transmission. 11 patients, all 11 are asymptomatic now. It's been a week. That's a good sign. And they have all been carefully monitored and will continue to be. We are working with the state health department on this right now, and we believe we have a low-risk situation. But it is important to confirm that this occurred at a nursing home, specifically in Brooklyn at 2266 Cropsey Avenue, the King David Center for Nursing and Rehabilitation. The healthcare worker from New Jersey also attended a small medical conference at the Westin Hotel in Midtown. Based on the follow-up of our disease detectives, the attendees are all asymptomatic. Also, his family is asymptomatic. A couple more points, and then I'll turn to my colleagues. We reported a man in his 40s who was a smoker and vapor. He was hospitalized. He has been discharged. Now at home, mild symptoms. Has a partner. The partner is under mandatory isolation, is asymptomatic, is the only contact of interest to our disease detectives. The last of the previous cases, this is the one we're most worried about right now. This is the woman in her 80s. It's not going to come as a surprise to anyone. We're really concerned for her. She is hospitalized and continues to be in very serious condition. So we are hoping and praying for her. There was a report in the media about an employee of The Gap. Best of our understanding, that report was erroneous. Came up Friday. We have followed up with the company. The individual, to the best of our understanding, not from New York City and does not have coronavirus. So any company that is has concerns and wants to connect with the city to report information, or has rumors that are not accurate and wants to help us dispel them, please reach out. And there's a specific place to go online. The words public-private at oem.nyc.gov, public-private at oem.nyc.gov, and Deanne, let's make sure they call to 311. That gets routed as well. Finally, I'm going to say a few words in Spanish, and I want you to hear from three of my colleagues. Esperamos más transmisión entre comunidad de coronavirus. Estamos implementando medidas nuevas y más amplias para contener el contagio. Repetimos, si tienen algún síntoma, vaya al médico de una vez. With that, let me turn next to our health commissioner. I want to thank her and her extraordinary team at Department of Health. They've been working very, very hard these last days. I want her to give you an update. Dr. Barbeau. And I want her to be taller.
I want to.
Okay, there we go. Do it again. Look at that smile. Okay, there, that's much better.
There you go.
You can be the spokesperson for elbow bumping.
That and alcohol-based hand sanitizers are going to be my. Good afternoon. First of all, let me start off by acknowledging that there may be many New Yorkers who are feeling frightened or sad because of all of this information that's coming at them. Every day we hear about new cases worldwide. We are in the city sharing information on a real-time basis. And so I want to just acknowledge that there may be some New Yorkers out there that are having those feelings. I want to encourage them to call NYC Well. It's an important resource that I think at especially this point in time can provide valuable support. The other thing I want to say is that fear is no excuse for propagating stigma. This is not a time for us to be buying into false information on the internet. I want to encourage New Yorkers to visit our website at nyc.gov/health for all the best information on COVID-19. They can also visit cdc.gov. The best way to guard against fear, against stigma, is by having the correct information. And so we are very much committed to transparency. The other thing I want to just emphasize that I think the mayor touched on is that this is a situation that is evolving on an everyday basis. We've been learning almost every day something new about how this virus behaves. And I anticipate that over the coming weeks, we will continue to learn more information about this virus. And so that's why it's so important to have the information, but also to know that this is, for the foreseeable future, at least for the next couple of months, something that the health department will need the support of everyday New Yorkers in order to really turn the tide. Last thing I want to say is, and just to really re-emphasize, that we are marshaling all of our resources, but we need New Yorkers to do their part. In that vein, I have talked about what I want New Yorkers to do. As the city's doctor, I need to make sure that if someone is sick with fever and cough, or fever and shortness of breath, they do not go to work. Beyond that, I want to make sure that New Yorkers are also paying that same advice to their children. If your child is sick with fever and a cough, fever and shortness of breath, do not send them to school. That's baseline advice, but especially important here during the COVID-19 season. There are things that we can do and that we are doing, and then there are new things that we want folks to do. So for example, we want people to continue washing their hands often, covering their mouths and their nose when they cough. And if they don't feel well, call the doctor, and I'll say more about that in a moment. But there are other things that over the course of the last few days we have been changing advice on. And the first thing you'll notice is we said, don't shake hands anymore, but do the elbow bump. And that's a way in which we can minimize the risk of transmission. The other thing I will say is that none of these measures that we are recommending are effective in isolation. We need to do all of them at the same time. So the frequent cleaning of surfaces, the frequent cleaning of hands, the covering of your mouth, for the foreseeable future, the elbow's not going to work. So I want New Yorkers to get used to the fact that that's our new normal for the next couple of weeks. The additional thing that I will say is, and let me just sort of re-emphasize what the mayor said in terms of the folks that we are especially concerned about. And it's those individuals with chronic underlying diseases, heart disease, cancer, diabetes, an immune-compromised system. What did I?
You got lung disease?
Yeah, chronic lung disease, cancer, diabetes, immunocompromised, heart disease.
We got 'em.
Yeah, I got him. And being over the age of 50. If you are sick, don't go to work. Call your doctor if you're not better in 2 to 3 days. We want you to make sure that you access care quickly. The other thing I want to emphasize is that beyond the individuals with these chronic illnesses, there are other individuals that we are particularly concerned about, and that is the elderly. So we want to make sure that individuals who are symptomatic and who may have a loved one in a long-term care facility, in a nursing home, don't go visit them. If you are symptomatic, the best thing you can do for your loved one who's in a nursing home, in a long-term care facility, is don't go visit them until you are better. The other thing is, if you've got, a grandparent that you haven't seen in a while and you want to take the kids to go see them and they are symptomatic, don't even do that. We want to make sure that elderly folks who have chronic underlying illnesses, we do everything that we can together as a community not to increase their risk. The other thing I will say is, again, to emphasize to the mayor, is if you're sick and your company has a telecommuting policy, we want you to take advantage of that. This is a great time, well, it's always a great time to stop smoking, to stop vaping, but this is especially a great time. And I want to remind New Yorkers that they can call NYC Quits, 866 NYC Quits, and they will be provided support. The next thing that I want to talk about is the importance of our healthcare delivery partners. And so we are communicating with thousands of doctors across the city. Tomorrow we will be issuing additional guidance about what we want them to be aware of. And so first and foremost, we want them to be aware that there is now COVID-19 testing available at commercial labs and how it is that they can go about accessing. We want them to prioritize patients in their practices who have chronic diseases, are over 50, and are symptomatic for that testing. We want to especially remind them of the importance of infection control. And this is one where, again, we don't want to take anything for granted. When you call your doctor, tell them about your symptoms. The best practice is for them, they want to see you in the office, to make sure as soon as you walk in and you've got those symptoms, to put a mask on you, right? Because I have said it in the past, there's a place and time for the use of simple surgical masks, and that is when someone is symptomatic and they're going to a healthcare facility so that they don't potentially infect other people. The other thing is, we want to make sure that all hospital facilities, all outpatient centers, have all of the supplies that they need. We reach out to them on a regular basis, but again, ensuring that we leave no stone unturned. And the other thing is, I'm hearing more and more that medical practices are putting in place what we're calling electronic visits. So if you can do over the web, if you can do FaceTime, that also is a measure that can help all of us in this shift that we're taking. The measures that we are emphasizing are so that we reduce the number of potential cases, but also reduce the potential harm to New Yorkers, and that's why it's so important for us that all New Yorkers are a part of this response to COVID-19.
Thank you very much, Commissioner. Commissioner made a really important point. I just want to say, anyone who is worried, anyone who's afraid, it's very, very normal. It's a confusing situation. It's a situation where people are being bombarded with information that, if, you know, that doesn't make you worried, I don't know what would. So it's really natural to be concerned, and it is an ever-changing situation, so there's that uncertainty. The Commissioner made a really good point. If folks are feeling anxiety, they're feeling stress, if they're worried, and they don't have a mental health practitioner that they turn to normally, you can call 888-NYC-WELL. You get a trained counselor 24 hours a day who can talk it through with you. If you need ongoing mental health services, they can help you get to it. So very normal and natural to be deeply, deeply concerned in a crisis. Don't suffer in silence. If you need mental health support and you need someone trained to talk to, 888-NYC-WELL. Now I want to turn to our Commissioner for Emergency Management. I want to thank her team, which has also been doing an amazing job coordinating so much around the city, and they are hosting us here for our many strategy meetings, tabletop exercises, etc. Commissioner Deanne Criswell.
Thank you, Mayor. Good afternoon, everybody. Yeah, I just wanted to take a minute to update everybody on what is happening here in our Emergency Operations Center. And so for several weeks now, we have convened more than a dozen interagency task forces that have comprised personnel from agencies across the city, as well as some of our partner agencies, to look at those impacts that we may expect from COVID-19. One of those key task forces that I want to talk about has been focusing on our continuity of operations and our continuity of government plans. So New York City's agencies provide key services to millions of New Yorkers every day, and we want to make sure that that work can continue uninterrupted and that all city agencies have their plans updated and in place. All city agencies have always had a continuity of operations plan. And so what we have been doing over the last several weeks is really fine-tuning those plans so they specifically address the impacts that we may expect from COVID-19. For example, city agencies are now putting processes in place that can support essential functions through telework, scheduling adjustments, including staggering work shifts, as well as the possibility of cross-training if we see a reduction in personnel. Our remaining task forces that we have here are also tailoring city response plans to meet the unique need of COVID-19 response. Some of these task forces are working upstairs right now in our Emergency Operations Center, and they include healthcare and 911, New York City Health and Worker Safety, Special Populations and Homelessness, Transportation, and Education. These task forces will continue to support this response as long as needed. We're also sharing information and guidance to our cultural institutions and our tourism partners, our faith-based community, to decrease the COVID-19 exposure and limit disruption to their services. As our senior New Yorkers, as you've heard today, are especially vulnerable to the effects of this virus, we are also working very closely with the Department for the Aging and our other human service partners to ensure our senior centers, adult care centers, nursing homes receive up-to-date guidance on how to limit the spread of the disease. One other thing that we have done here at the Emergency Operations Center is activated our Logistics Center. They're working closely with the Department of Citywide Administrative Services, our city, state, and federal partners, our private sector partners, and they are tracking and prioritizing any resource requests that we get. We are also keeping a close eye on the global supply chain and monitoring any potential impacts that New York may see. During emergencies, New Yorkers always help their fellow New Yorkers, and COVID-19 is no different. We all have a role to play in keeping our city safe and healthy by staying home when sick, covering your mouth and nose when you cough or sneeze. And we want to be able to make sure that we can connect with New Yorkers and give you the vital information that you need as this progresses. So as you heard the mayor say, we are launching today a Notify NYC that is specific for COVID-19. We want you to text COVID, COVID, to 692-692. Again, that's COVID, COVID, to 692-692. and we will be pushing out important information as this progresses. Thank you.
Thank you, Commissioner. Finally, I want you to hear from Dr. Mitch Katz, CEO of Health and Hospitals. Want to say, by way of preface, right now our team at all of our health and hospitals facilities are doing their job. They're not only dealing with this, they're dealing with all the other healthcare needs of the people of this city. But the important point to recognize is the capacity we have. We have the biggest public health system in America by far. Dr. Katz and his team are doing a great job preparing. We've already talked to you about how many beds we have available if we need them. But Dr. Katz is going to further explain, in addition to broad guidance he'll give, he's going to explain the point of how we would respond as needs intensify around coronavirus. Have to free up capacity to address this crisis without compromising healthcare, and that is a pre-planned protocol that Health and Hospitals has in place. We want you to understand it. Dr. Katz.
Thank you, Mr. Mayor. This is a moment when New York City can be proud that it has always maintained a robust public hospital system. We have 11 acute care hospitals. We have 60 other outpatient sites where we're able to provide care. Today we are seeing people who have symptoms suggestive of COVID-19, people who have cough and fever or shortness of breath or fever, and we are able to see them in our facilities. We are able, through our commercial lab, to test those people who turn out not to have influenza or another cause. As the mayor spoke, we've spent the last several weeks preparing all of our facilities so that if there is an influx of tens of patients, if there's an influx of hundreds of patients, we are prepared to do that. The way that you do it is by having protocols that first look at who is in the hospital for some other reason, who can be cared for at home, and you rapidly discharge them. You cancel elective surgeries. This is not a moment where we will be doing elective gallbladder removals, doing hernia repairs, important surgeries, surgeries that have major impacts to the quality of people's lives, but we can do them, we can reschedule them for after this outbreak. During the time of the outbreak, if we are having tens or hundreds of new patients, those patients will be rapidly discharged. Outpatient services will be canceled, and we will pull all of our doctors and nurses into our inpatient areas so that we can provide adequate care to all those who need it. Every single hospital has a plan of where that care would be provided if there are hundreds of more patients. In some cases, it's a cafeteria. In some cases, it's an auditorium. In some cases, we have tents that are specially made for creating clinical areas in parking lots. Each hospital knows exactly what it would do depending upon how many patients we have. We have enough supplies and we have access to those supplies. We watch them every day. I participate in a call about face masks, about antibiotics, about fluids, and we are prepared if this pandemic gets much worse in New York City. Thank you.
Thank you, Dr. Katz. Okay, covered a lot. Thank you for your patience, everyone. Let's take questions. My colleagues will come up to help answer.
Mayor, have you spoken to President Trump or Vice President Pence, who is leading the coronavirus response?
No, our team has been in touch with federal officials. We've continued to make clear, we obviously have a lot of capacity to deal with the situation. We're working very closely with the state. That's the crucial partner here. What we need from the federal government is very straightforward, and it's been the case for weeks and weeks. We need help with the testing. If they will take care of that part of the equation, we can take care of our share for sure.
Have you given any thought? I know you're holding firm on public gatherings in the city, but next weekend is a half marathon.
We're assessing that. We're talking to the folks who are running the half marathon. That's a decision we're going to make pretty soon. We'll make it with them. We obviously want to give prior notice, but we're not there yet.
Can you give us details on the testing, your capacity, how many tests you've done to date, what your per day capacity is?
Sure.
And some details on the type of kits you're using, whether it's CDC, local state labs.
I'm going to start. My colleagues can jump in. So right now, in terms of our public health labs have been going nonstop, and luckily, just as they were reaching capacity, the private labs have come online. What we want to see is faster testing. So in terms of pure numbers, with the private labs now, we are well ahead of the level of testing that we need numerically, but not in terms of speed. We want a lot faster than we can get with the current protocol. But to give you the overall numbers, and I don't have the math in front of me, but it's easy enough to do. We have 13 positive cases, 146 negative cases, and 76 pending tests since the beginning, so we're pushing up towards almost 250. But we've been able, obviously, to get all those done. The pendings we'll have in the course of the day. We need to be, right now, we could handle hundreds of tests in a day, but not as fast as we want. Our goal is to get that FDA approval, to be able to do hundreds of tests same day, ultimately thousands of tests same day. That's where we need to get to. Did you have another part of your question? I'm sorry.
Well, how long do you think it would take how long do you think it would take you to get to hundreds and then thousands?
If we got FDA approval, what I'm told is it would be a day or two before we'd be up to hundreds that could be same day. Yes, sir.
Can non-public schools also ask for and get a nurse in their building?
If a non-public school needs medical assistance, we're going to work to get them help. We have the first thing we had to do, of course, was account for the public schools. We're happy to work with any non-public school to see what we can get them. Obviously, we're trying to draw on whatever capacity is out there in the community. But any non-public school that needs help should immediately communicate with the DOE. Yeah.
One other question. Tomorrow evening, Purim begins.
Yes.
Is it safe for people who have no symptoms to visit parents and grandparents?
Yeah, the point is, and the commissioner can jump in, yeah, if no one has symptoms, neither the visitors nor the people being visited, yes.
Two questions, one for you. So we're now at 13 cases.
Yep.
Will there be a point where you will consider closing schools? Do you think we'll ever get to that point? If so, what number are you?
So, look, the important point here, I'm going to keep emphasizing, literally each day we're getting new information, and we're dealing with a disease that's not fully understood. So it's a very unusual situation. We're going to every day ask ourselves the whole set of questions about what we should do. But I will say definitively, everything we've seen so far, this is a disease that for a healthy child presents minimal risk. We do have a concern about children who have one of those 5 pre-existing conditions. We want to take special care with them. So the schools is not the place we'd be looking first in terms of trying to address this problem. Obviously, I'm saying this as a parent as well. I think parents want to see the schools keep going so long as it's safe, want to see their kids getting educated, and we do have a tremendous interest in avoiding the disruption of the city unless there's a very specific reason to act otherwise.
Would there be a specific number of cases where you'd say, okay, maybe we should?
It's not as simple as that. It's very much about the combination of what we're seeing in terms of the numbers and what we're seeing in terms of the constant flow of information about the disease. The point Dr. Barbeau has made over the last few days, her disease detectives are literally gaining new information in real world conditions. You know, a lot of what we're getting out there from the guidance is based on other places. And I assure you the dynamics in China and Italy and South Korea are different than here. But also a lot of it is theoretical, it's academic research, et cetera. This is the real world, frontline, New York City, no place like it on earth. And our public health officials are getting real world information about how things are playing out here. We're talking about it every single day and making adjustments. So there's no simple algorithm. When we get to the point where we think anything needs to be adjusted, we will. Now what I've found is New Yorkers are really doing a fine job of listening to guidance. So we're telling people now, if you're sick, don't go to work, don't go to school. Make adjustments you can. If you can telecommute, do it. If you can do different staggered work hours and take the subway at a different hour, do it. If you don't need to take the subway, you don't have to, that's great. I guarantee you a lot of people are going to make those adjustments. And that's going to put us in a stronger position.
The 2 ladies in Brooklyn that were in Egypt on the cruise ship.
Yep.
Were they on the cruise ship that is currently under quarantine in Egypt, or a different cruise ship?
I don't know if we know that. Do we know that, anyone?
We'll have to confirm.
We'll confirm that back.
The Uber driver who's hospitalized in Far Rockaway, can you tell us where he drove on Long Island and whether any of his passengers are being screened for symptoms?
All I understand is Long Island registered and did all his driving on Long Island. We can see if we have more than that. So this is important to understand about car services, taxis, Ubers, etc. So basically, again, remembering that you need that kind of direct hit for transmission. Obviously, anyone who's a driver has every reason to be concerned and vigilant, but you would need, that cough or sneeze to get right into you. We don't have an indication of any customer being affected, but we're certainly going to be looking at that. But we are giving guidance to TLC drivers, not only about continually keeping their vehicles clean and sanitized, but also, this is really simple, really important. This is what our doctors said immediately when they started talking about drivers. Open your windows. The circulation of air, I know that's not always possible. Whenever possible, if you're a professional driver, keep your windows open. The circulation of air literally disrupts the possibility that that projection of a cough or sneeze might get to the driver. It's a simple, important step that they can take. Let me come over to this side. Yes. Yep.
There were reports that there was an Asian man in Brooklyn who was stabbed in a suspected coronavirus hate crime, and I was wondering if you could provide any more information on that and if it is being investigated.
I need to get more on that. I don't have, we've heard obviously some very unacceptable instances of discrimination and hate speech, all of which is inappropriate, a lot of which is illegal and we're going to follow up on. But I don't have that specific connection you're talking to. Let us confirm that.
You mentioned that we could see hundreds more cases in the next few weeks. Is there a tipping point where the capacity for, say, disease detectives or something to that effect, is there a tipping point where the number of cases just overwhelms city resources, and if so, when do you anticipate that might happen?
So I would say there are a couple of different pieces. In terms of the work of disease detectives, we're going to use them in different ways depending on what we're dealing with. I mean, there are health professionals that right now they're doing the thing we need the most, because we are able to trace and we have a finite number of cases. As you see, so far the contacts have been limited in each case, and the precision has been intense and the follow-up has been quick, and that's a great thing. We want to keep doing that. If we get to a point where we need to shift all health professionals towards direct service of folks who have contracted disease, we'll make that shift. That's a day-to-day decision. That's something that would be, as you see, a major uptick. But in terms of the overall capacity of the system, as we talked about days ago, we have 1,200 beds that we can activate readily. We can go farther than that if we take additional measures. We have the biggest public health capacity in America. We have a lot of voluntary hospitals, nonprofit organizations helping us. We got a lot of capacity. And what Mitch said has not really been introduced into the equation. I want to emphasize it. There's so much that happens in a hospital every day that if it had to wait, could wait. I mean, I was just in a hospital getting arthroscopic surgery a few weeks ago. If we're in the middle of a really intense challenge around coronavirus, we're not going to be doing arthroscopic surgeries. People like me are just going to limp a little more for a while, right? So there's a lot that can be opened up where our existing all of our existing capacity then gets turned to this challenge. And there's just no place in America that has anywhere near this much medical capacity. So just the fact that you'll turn off a lot of non-essential things and turn all that talent and capacity to a crisis should give New Yorkers a lot of confidence that, even with hundreds of cases, we'd be able to handle it.
Mayor, is the test a blood test? Is that how you test for this?
I'm sorry?
Is the test a blood test or something
It's
else?
a swab. Why don't you describe it?
So the test is essentially putting a medical grade Q-tip up a person's nose, swishing it around, taking it out, and then putting it into a medium. So it's not blood, it's something that's very easily done. And we also take oral swabs.
And so if people go to their primary care doctor, will their primary care doctor test them there at the office, or do you have to go somewhere else to get tested?
So right now, with the commercial labs being able to do the testing, providers will have the opportunity to do the test and to send it directly to a lab. They can visit the websites of the various labs to know sort of the nitty-gritty. The important thing here, though, is that we still want providers to go through the history, ensure that there are the symptoms of fever and cough, or fever and shortness of breath. We're not encouraging asymptomatic New Yorkers to go to their doctors and ask for the test.
Can you also, I'm sorry, just let me help you with this in terms of like news you can use. Talk about BioFire as the first step too.
So BioFire, as we've been saying all along, is a very simple test that's also done through the nose and nasal swab that can help rule out the 26 most common viruses that can account for someone's cold-like symptoms. So there's a whole range of them. If that test is negative and the person is symptomatic, then we would go to the COVID-19 test.
But if it's positive, just, I'm sorry,
And
one
if
more.
it's positive, then that explains the person's symptoms.
And you don't need to do.
You don't need to do the COVID-19.
I'm your coach.
Thank you.
One last question. The transmission facts that were given earlier, are those agreed upon science with the CDC, the WHO?
Say more about what you mean by transmission facts.
The spitting, the coughing, the sneezing.
Right,
directly
that
into
it
people.
only lives for 2 minutes on certain surfaces, all of that stuff.
Correct. So we are learning about how this virus is transmitted on an everyday basis. And to give you a very concrete example, initially we thought it was just prolonged household contact that was the biggest risk factor. With the work that the disease detectives have done and documented how it's being transmitted in the community, we are adjusting that guidance, right? It's not just prolonged household contact, it's the very graphic description that the mayor has given. And so that's one. What has not changed is that it's only by droplet spread. This is not like measles, where if you come into a room where someone with measles was there an hour ago and they left, it's still hanging in the air, and if you haven't been vaccinated against the measles, you can get it. So this is by droplet spread.
Direct.
Direct.
And I want to add one thing just to clarify the surface point, because this came up on Friday. We have a different interpretation on surface life than I think the WHO. And Dimitri spoke to this, we were pretty clear about that. We do have a different interpretation.
Right. The other thing to note is that this is a brand new strain of a known family of viruses, and so some of the guidance is based on how those other strains within that family behave. And so there's no scientific studies that I'm aware of that have studied this new strain to give exactly, is it 10 minutes, is it 20 minutes, but from our best informed scientific information, from learning from scientific partners around the world, in real world situations, it's a few minutes, anywhere from like 2 to 3 minutes, a little bit more, a little bit less. But I think that's an area that still needs further scientific investigation.
Commissioner.
Hold on. Okay, let me do that one. I'll come back to you. Go ahead back there.
I wanted to see if I can get more information on the FDNY order regarding segment 2 calls.
Sure.
And Commissioner Nigro, feel free if you would like to speak as well. Why was that order made, and when might that be taken off the table? Some might see this as resources coming off the table when they're needed most.
Well, I think as you've heard, this is not a situation that's likely to end tomorrow or the end of next week. So an agency's biggest resource, most important resource, is their people. And so we have trained medical personnel, EMTs. All of the calls to 911 are, say, well over 90% result in a transport. All those transports are done by our EMTs and paramedics and ambulances. So our firefighters are still going to the most serious calls of cardiac arrest, of choking, of major traumas, but we've taken them off some other call types that are less likely to be life-threatening in order to play this game out, play the long game. So if it was a sports analogy, we'd say if you use all your resources in the first half, you're likely to lose the game in the second half. The fire department can't afford to lose a game. You know, we've transported folks with measles and tuberculosis and Ebola quite successfully. Our people are highly trained and highly skilled. So I think the department is being prudent, being proactive, and we'll see how, as you've heard, each and every day we learn something else, and we'll review everything on a daily basis.
If I could just follow up, the EMS unions have said they are stretched thin, that it's essentially not fair for firefighters to be taken off the job when there could be a lot more activity. What would be your
Well, I
response?
think we have to keep in mind the EMS unions are perhaps not as happy as they may be in their plight lately. You've heard that before this came out, and that may play into what they're saying publicly.
Commissioner Popo.
Hey,
Well, I'm here first.
has there been any discussion about maybe putting some of the work on subway trains aside? Because particularly on trains like the L, which don't run regularly on the weekend, they are packed to capacity, like multiple.
When you say the work, you mean like track repair and stuff like that?
Yeah, like to make trains, you know, come more frequently and not be as crowded.
And I think it's a great question, and obviously, I will say this for the record, we don't run the MTA, but but I think it's a great conversation for us to have with the MTA as to whether in this environment there are maintenance efforts that could be delayed to keep more frequency. I think it's a fair question. Now, obviously, if the maintenance is to keep the trains running, and you might lose capacity without the maintenance, well, we want to play the long game there too a bit. But it's a great question. We will pursue that and have an answer on that tomorrow. Go ahead.
Commissioner, I want you to please say some words in Spanish. De acuerdo al ritmo que ha llevado el contagio en Nueva York, ¿cuánto tiempo se espera que dure la estación, el periodo? Y si han planeado algún posible escenario para cancelar eventos públicos, si algún número.
En este momento estamos aprendiendo algo nuevo casi cada día en términos de cómo se transmite este virus. Ahora mismo estamos dándole los consejos a los neoyorquinos de asegurarse que tomen medidas para reducir su riesgo y también para no contagiar a otras personas si tienen síntomas de fiebre y tos o fiebre y ¿cómo se dice? Fatiga. No queremos que vayan al trabajo por lo menos por 2 o 3 días hasta que no tengan síntomas o sin llamar al médico primero para hacerse la prueba de coronavirus 19. En términos de otras medidas que se están tomando en la ciudad, estamos pidiendo que si una persona tiene síntomas pero puede trabajar de su casa, entonces que lo haga. Lo otro muy importante es que si una familia tiene un ser querido que sea mayor de edad y que tenga enfermedades crónicas como problemas con el corazón, cáncer, diabetes, problemas con los pulmones crónicos o tenga un sistema inmunológico comprometido y tiene síntomas, que no vaya a ver ese ser querido. Lo mejor que podemos hacer es proteger nuestros mayores de edad. Lo último es que ahora mismo, en este momento, tenemos varios escenarios para ver cuál sería posible, pero en este momento no tenemos ningunos planes para cancelar eventos grandes, pero obviamente eso sería una decisión que se haría con las personas que estén poniendo el evento. O en términos de lo que estamos esperando, ahora mismo lo que se espera es que sea definitivamente varias semanas, y como dice el alcalde, estamos esperando que esto sea nuestra nueva realidad por varios meses.
Una pregunta en español, perdón. Sorry, another question. Cuando hablan de que el gobierno federal está teniendo una respuesta lenta, ¿qué es lo que quisieran ver diferente en este caso?
Bueno, específicamente la capacidad del laboratorio es algo muy importante. Estamos esperando, el alcalde ha demandado que el gobierno federal aprueba el diagnóstico que se pueda hacer más rápido, porque es la diferencia entre 3 o 4 días esperar el resultado por los laboratorios comerciales. Ahora mismo, reducir ese tiempo de días a horas.
¿Cómo eso puede mejorar la estrategia?
Bueno, Lo importante es, en parte de este brote, saber tempranamente si una persona tiene coronavirus 19 nos ayuda a dar mejor aislamiento, gracias, a los que están afectados y a sus familias.
So everyone, we don't need to, I think we've covered almost everything that Oxia has said previously in English, except just to clarify that, we're in this for months. We don't have the exact number of months for you yet, but months is the way to think about this. We'll be at this for a while. Okay, let me see if there's anything else before we close down. There will be regular updates, obviously.
There's lack of hand sanitizer around the city. You cannot find any more hand sanitizer or any supplies like this.
Well, I'll tell you something. I've been in a lot of places where I see hand sanitizer out. I agree there's less and less in the stores, but I think a lot of people have stowed it away and are rationing it out. We certainly want to make sure that working with the private sector, working with the federal government, that we continue to see that supply. So that's something we'll be following up on. Working with the state, working with the federal government. It's still being produced out there, and we're one of the places that needs it more than most. So we want to work to see the supply come in. And this is the point about the federal government again. I learned this a long time ago. No one should have the assumption in mind that the federal government actually comes to the ground and helps in a crisis, except for the most dire emergencies when the military is mobilized. Basically, the federal government provides financing and provides logistical support. So we've been asking, and then legal approvals, things like that. We've been asking for approval on the testing incessantly. It's really troubling that hasn't come. But the other thing we talked about is the supply of masks, and now I think hand sanitizer is another great example. This is where the federal government needs to step up. They can ensure that the supply that's available in the country is appropriately distributed to where the need is greatest. I think pure math tells us we're one of the places that needs help compared to a lot of other places in the country that, thank God, don't have cases. So I'd like to see the federal government step up, help us get the masks we need, help us get the hand sanitizer we need. Those are simple steps, and if they would do those things and just stay out of the way otherwise, we would be able to handle this situation.
So is that what you would personally want to say to Vice President Pence or President Trump or anyone from the federal government?
Yeah, but I want to, it is great. I mean, I'm happy to talk to any of them. We were scheduling a call with the Health and Human Services Secretary, but again, I think this stuff has been said so many times, so many ways. It's just time for them to do it. I don't think this is mysterious stuff. We've been talking about the need for masks for weeks. It's just time for them to create a distribution structure and enough of a command and control that these things get to where they need it.
Are you hopeful?
I'm hopeful that here we can handle a lot because we have a lot of talent and we have extraordinarily strong agencies and the best medical capacity any place in the country. We were just legendary hospitals, both public and private. And I think New Yorkers are listening, and I think they're making the right adjustments. So I am hopeful about what we're doing. I am confused about what the federal government is doing, and am I hopeful they will get their act together? I'd like some more evidence. I will quote, as I often do, Ronald Reagan, and say, trust but verify. I would like to see some evidence. So how about the FDA approval? If they could get that done today, tomorrow, that would be a real sign of progress. A few more, and then we'll shut down for today and get you more tomorrow. Go ahead.
Could you, going back to the sort of expecting hundreds of cases in the coming weeks, could you elaborate on that a little bit? Meaning, is that based on some specific modeling that you have? And when you say hundreds, we're talking about obviously positive cases. Weeks, we're talking about 3 weeks, 4 weeks, 8 weeks?
So the best guess today, but ask me again tomorrow, is in the next 2 to 3 weeks we'll be at least 100 cases since day one. So we're at 13 today. That's played out over the last week or two. That pace is going to pick up because of community spread. So if we were guessing right now, based on, and I said guess, based on a lot of data and modeling, we would say we'll get to case number 100 somewhere in the next 2 to 3 weeks. But again, we're watching every day. We might change that estimate up or down each day. But at some point, it could easily be hundreds of cases. And that's daunting, except against the backdrop of all the capacity that we just outlined to you. And a reminder, so let's go back to these overall facts. This has really been pretty consistent, that 80% of the cases result in very mild symptoms, 20% more serious, but of that, the vast majority, even if it's a more serious challenge, it still ends with the resolving of the disease and people going back to their normal life. For a very small number, very tragically, it can be fatal, but that's a very small number still. So given that, we can tell you right now, the vast majority of our cases are going to be people who come through fine with limited impact. And that breaking out into categories, I really ask you all to share it, that the #1 largest population category in New York City, under 50-year-old people who don't have one of those 5 pre-existing conditions. For those folks, with very few exceptions, it's going to be a very mild experience. So that's where we think, when you add all those facts together, we have the capacity to handle this crisis. Last call.
You mentioned military. They do a lot of research and biological stuff. Do they know anything about this virus? And also, can they rule out that there's not anything involved in any terrorism?
I can't answer those questions effectively. I doubt my colleagues can too. If the military has research, I want to believe, meaning that would be helpful in addressing it. I would assume the federal government would bring that into play. I don't think they would hold it back. I have not heard anyone suggest that this is anything but an organic disease that developed as we've seen in the past, and I think its history is pretty well documented, so I have no reason to believe it's anything but, unfortunately, something that derived in nature.
Last two.
Yeah.
This is concerning the 11 patients from the Brooklyn nursing home. How are they being monitored, and are they in voluntary isolation?
We can get you more. They are being monitored. They're all asymptomatic. It's been a week. They're certainly being watched carefully. I'll speak to it.
So they are all in private rooms and being monitored daily, so they're in the appropriate level of isolation.
Okay, last call. Yes? Yeah.
So you just mentioned there's a 2 type of test. If the first test comes as a positive, and you won't test the coronavirus. Is it possible the person also get the flu, also get the coronavirus, the 2 type of flu in the same person?
To our knowledge, that hasn't been studied enough, and we don't have a good indication that that's commonly occurring. And so our guidance, the guidance that the World Health Organization and others have been giving, is that if the biofire is positive, that is the definitive diagnosis. However, I will add, that we always want doctors to practice good clinical judgment. And if someone does have influenza and they're not getting better, then certainly that would be a situation where we would want them to contact us and have more in-depth conversation. But again, it's not, to my knowledge, something that has been seen in the literature.
I want you to, respectfully, I think a little restating there would be helpful to everyone. Your general view, if you get a positive on the biofire, which is the other more traditional, if you'll forgive the phrase, more traditional known diseases, if you get a positive on the biofire, what does that generally mean?
Positive biofire means you have one of the 26 viruses that it's accounting for the symptoms that you have.
And not coronavirus.
And not coronavirus.
Based on what we know now.
Yes.
Yeah.
Just a little more color on small businesses. In order to introduce these grant and loan programs, they must be hurting pretty bad. What have you heard from small businesses in terms of what they've been going
Greg
through?
or James, who wants to speak to that?
Yeah, so first up, just want to encourage New Yorkers to support our small businesses. We've heard from mainly restaurants, catering halls, etc., sales declines of 40 to anywhere up to 80%. We're getting increase now from small businesses about what to do with their employees, so these 2 programs will address that.
Okay, last call.
To elaborate on the smoking and vaping, does that also include the medical marijuana patients?
It's always, let me start. Smoking and vaping are our major concerns. If someone is taking medical marijuana by vaping, I think we would want to look more into that. But if they're taking it through other measures, then I don't think that that would be a situation.
So you don't think that that would be a factor?
Vaping and smoking combustible cigarettes are the major factors.
Thank you.
Yes.
The 80-year-old woman, she's the one in the most serious condition.
Yes.
Is there anything you can tell us about her? Was that transmitted through travel or through the community? Was
Remember
she
on that
living-
one? Remember that one offhand? We can get that.
Okay.
Yeah, we don't have the profile in front of us. We'll get that to you quickly. But that's the patient we're most concerned about right now. Okay, everybody, we will get you more updates tomorrow. Thank you very much.